are joined by our one of our favorite people to talk to. We talk to him all the time on this show. Our medical expert, Dr. Jamie Taweel, internal medicine specialist at Grand River Medical Associates. Dr. Taweel, welcome to the program.
Thank you for having me. Thanks very much. I don't know if I get the distinguished one of our favorite people to talk to,
Oh,
but
you are.
I appreciate that.
So how are you? How's your team?
Team's doing okay. Again, the office is open back up. It's a slow, limited role, so to speak, where because we have to space out the appointments and trying to put it all together slowly. It's been a rough go. So far so good.
At a press conference yesterday, Governor Whitmer announced non-essential medical procedures, dental procedures, veterinary services, and so on will be permitted again beginning on May 29th. Have you seen in your practice, or have you heard from other colleagues throughout the industry locally, any rush for people to schedule their checkups or schedule these appointments with their medical professionals?
I'm finding that people are pretty okay with doing a lot of the telehealth virtual types of appointments. People seem to like that because they're still concerned about going outside. They're still concerned about meeting with people. They're, trying to practice social distancing and are cutting corners where they can. And I think that they're very appreciative of that option. And so they're still using it. Now, that doesn't mean that I'm also getting a lot of people that are calling me for dental issues because they can't get in with their dentist. Like, I feel like my tooth is infected. Can I get an antibiotic? So then that ends up, I have to kind of practice a little bit outside of the box, write for antibiotics for things like that when they should be seen by their professionals. So I'm seeing people trying to cut corners here and there, and I have others that are just anxious to get back in.
And so on that note, if someone, people are still eager to do telehealth if they can, and some people really do want to get in and visit their doctor right now because they have a sore tooth and they can't get into the dentist or something along those lines like you mentioned. What are some of the cases where somebody should really look to schedule an in-person appointment versus a telehealth appointment?
Well, it's very difficult. I mean, some telehealth gives me everything but the actual patient, which can be a little bit difficult to diagnose. And sometimes through telehealth, things are vague. I mean, if it's something that's very simple, common cold, I feel like I have a urine infection, something, a rash that they can actually point to, that makes it a little bit easier. But if it's something that's vague, I feel like there's something here. I don't know quite what that is. Usually during those telehealth visits, I'm able to say to them, look, this needs to be evaluated a little bit more personally. Also we want to be able to do a physical exam, vital signs, things like that. I want to check for lymph nodes, make sure things aren't popping up that shouldn't be popping up. If you feel like you're having trouble swallowing, I mean, the list goes on. So some things are simple that are telehealth capable and some things aren't. And typically during those telehealth visits, I'll say, look, I think you just need to get evaluated. We need to kind of push this in a further direction.
So in those cases, some people may be hesitant to get back out and schedule their much needed checkups these cases. They may have had telehealth appointments and you say, I really need to have you in the office so I can check you more up close and personal to really get an idea of what's going on here. For people that are a little bit hesitant, what do you have to say to those potential patients who maybe are afraid of coming in for those checkups to ease their minds a little?
Well, I will, most importantly is to evaluate getting a story just to see if it's something that's dangerous. Is this something that needs to be addressed, or is this something that needs to be addressed right now? So I can usually say, look, this can wait a little bit, but I wouldn't wait too long. I'm not quite sure what this is. Here's the risks. Here are the things that I'm concerned about, and if we sit on it too long, this is what could happen. And if I have to explain that, and if the patient's willing to take that risk, then, I'm doing the best that I can. Now, there are scenarios where I say, look, this cannot wait. And I know that you are concerned that you might pick up something like COVID. However, the risk of that is outweighed by the risk of what I think you might be dealing with. You schedule a virtual appointment and tell me that you're having chest pressure, and I'm concerned that this might be a heart attack. I'm going to recommend that regardless of what your concerns are, you need to go to the emergency room. And I've done that on occasion with some patients of mine that unfortunately had symptoms that were a little bit more important than what's going on. And also bear in mind, emergency rooms have had very good plans in place to get people through them, as are doctors' offices. They have very good plans in place to get people through them with the least amount of risk of contracting COVID-19 if there happened to have been an exposure in that area. So we're doing the best that we can. Some concessions have been made. There's some patients that we've talked to and said, hey, again, this can wait a little bit. I usually get you in every now and again so I can monitor this, but I'm willing to let that go a little bit further. And everyone kind of gets it. So, but when things do get a little bit out of control, you have to explain to them that this is, unfortunately, you got to get seen.
In terms of risk reduction, with these restrictions being lifted, non-essential medical procedures are going to be permitted again on May 29th. Maybe that presents a little bit of a challenge for these doctors' offices that have seen some patients in person pop up here and there throughout this process, but now with more people coming in, what are some of the precautions that are being taken and those changes to get people in and out quickly but also safely that may have to be modified a little bit as more of these non-essential procedures come into medical offices?
So non-essential procedures coming into medical offices are going to get screened before they even come in the building. At least this is the plan in place at my office. You get screened before you walk in the door. If you have risk of exposure, if you have temperature, any types of symptoms that are listed from the CDC, then you get screened in the parking lot and you don't come in the building because we need to reduce that risk. And the non-essential procedure will get put on hold until we get a verified negative COVID screen, which we do. And that's how they're doing it for outpatient surgical centers. All pre-surgical patients typically are getting screened. You do not want a patient coming in and essentially contaminating an entire team that's working on getting procedures done. But these screenings are going to be in effect before people come in. Now, if people do come in, they pass the screening, those procedures will get done. For you coming to my office, you get past the door, so to speak. You end up with an appointment with me. We're all wearing personal protective gear, and we are, the patient's wearing a mask. I'm wearing a mask. We're doing the best that we can. After the patient leaves, they're going through kind of a flow. They used to come in and out the front door. Now they're coming in the front, out the back. Then we're now doing an entire cleanup of the room, sterilizing it from top to bottom, wiping everything down and going from there. Patients aren't allowed to bring anybody with them. They have to come alone. So I'm having some problems with elderly patients that typically have people accompany them. Those are the ones that we're trying to reserve for video health calls if possible. And we've essentially closed the waiting room. So people have to wait in the parking lot, call before they can even come through the door. So these are all the small things that we're doing, and I imagine that they're doing that at other places as well. Seems pretty standard.
A lot of protections are being taken and a lot of precautions being made to keep people safe in these offices. In the event that, like we talked about earlier, someone has a telehealth appointment and you see something that you want to really, that you or another doctor, Dr. Jamie Taweel, may say, I want to see you in person. This is something that needs an in-person checkup. They come in, they get their screening, and they are showing some COVID symptoms. In terms of turning people away, what do you do in that situation? Where do you send them? How do you address that in terms of keeping the patient safe, but also keeping your facilities and your other patients safe from COVID?
Great question. So if you come to the office, you have something that needs to be seen, you get to the parking lot, you have tested, let's just say, for example, your temperature is elevated. Now you're at risk for COVID. So what happens is I do a swab, we test you on the spot. You got to go home and self-quarantine until something is, you go home, self-quarantine. I would recommend going to the emergency room if, let's say, for example, you came in because you were having the chest pain and I needed to see you. You got to go to the emergency room at that point so that they can better evaluate you and make sure that you're being separated from everybody else. And it's an important thing. Otherwise, I would send you home. I would wait until the test comes back. The test either comes back negative or you have to be 72 hours without symptoms before I would recommend you coming back through so that we can evaluate you. That's kind of where we're at right now. And if it's positive, then you're going to be asked to stay home until your symptoms go away for at least 72 hours and you are considered high risk. And you would basically stay home until this either blows over or your symptoms get so severe you have to go to the hospital.
And is that, at that point, is that a communication between you and the patient about what goes on going forward? And if they do test positive, but they still need that certain checkup, how do you communicate between your patient and between maybe a hospital or another facility that's ready to take a COVID patient for non-COVID related medical issues as well to make sure that they're getting the treatment that they absolutely need?
Well, emergency rooms are fantastic in terms of just communication. So if, let's say, for example, the patient had, we're going to keep using the patient that came in, he or she has tested or at least has symptoms that are concerning for me for COVID. And so they can't be seen. They have to go home, but they do have an issue that needs to get addressed. If it's something that I can address, then I will. If it's just a medication refill, but if they have symptoms that are more severe, I can't risk them coming in and contaminating the rest of the office. So I would probably suggest they go home until they're asymptomatic. If they do have something that needs to get evaluated, then they have to go to the emergency room. I'm not going to send a very simple case to the emergency room. I'm only going to send severe things, obviously. Mental status change, dizziness, chest pain, things like that, severe blood pressure issues. Otherwise, if they do have to go to the emergency room, then I will actually call the doctor, tell them that I'm sending the patient, and tell them my concerns and coordinate that care with the physician. And they've been all very good about coordinating back with me. They usually call if they have further questions, and so on and so forth.
So let's talk about masks now. People are going back out in the community. They are required in enclosed areas, and in many stores, such as grocery stores, are requiring people to wear masks when they're in the store. A lot of people may not be doing so effectively. Either they just don't know how to do it right, or there's just little things that they're maybe not catching. From a trained medical professional, in terms of wearing a mask, what is the most effective way? How should we be wearing our masks? And what are some common issues that maybe you see out on the town, and how we can correct them?
Absolutely. Well, first, the most important thing is wear it. I have patients that are not just, I see people just not wearing masks. Wearing the mask obviously has to cover the nose and the mouth. Please try your hardest to do that. A lot of people have been basically having their nose sticking out over the top of the mask. That is absolutely, it's as if you shouldn't be wearing one. I know masks are restrictive. I've already had patients ask me for, patients that feel that can really exacerbate their claustrophobia, so they don't want to wear one, and they're asking if it's okay to not wear one. I just, some cases I would just hope that they can try and get through it as best they can. You want the mask to cover both nose and mouth. You're trying to prohibit things from getting into your airway. This is a respiratory thing. So try to keep it, you don't have to make it so tight. The N95s need to be tight because they're particulate masks. They need to be able to, you can't let air get around it. It needs to be a tight seal because you're breathing through it. Other than that, they're doing the best that they can. Just please keep wearing it. Most people I've seen it hanging off the ear or around their, down here. It's becoming it's becoming interesting.
It is interesting to see people, particularly at red lights, where I just glance over, check my mirrors, and I just see someone in another vehicle over, and I look over and I'm like, oh, that's odd, what they got going on there, and I see their mask around their neck as they're driving, because you don't need to keep it over your face when you're in your car, and it gets hot there.
Of course.
So you said it with the N95s, they need to be tight because they're trapping the particulate matter from getting in. And in terms of other just general masks, they can be a little bit looser. Is there any concern with that about particles from someone that maybe is asymptomatic getting out of there? What precautions should be taken in that situation?
I'm not sure I understand the question. Can you run that?
So like if if someone's mask is maybe just a little bit loose on the sides, maybe. It's covering their nose, it's covering their chin, it's a little loose on the side. Is that a cause for concern? Should they be maybe using a different mask, or is that okay?
No, I mean, right now the CDC has recommended that cloth masks are acceptable. So we're basically trying to just prohibit that direct air, that direct exposure. So, N95s, I don't believe are necessary for day-to-day activity as long as you're practicing social distancing. I feel that N95 should be reserved for healthcare workers that are, actually dealing with COVID patients, or healthcare workers that are seeing large volumes of patients to minimize exposure. I wear an N95 when I'm dealing with patients. But I think if you're going to go out and you're practicing appropriate social distancing, a cloth mask, as long as it's covering both the nose and the mouth, should be a sufficient way of reducing your transmission. Is it going to make it zero? No. But we're trying to slow things down, not prevent things. So I think this is going to be the best option that they can have. Obviously, wearing it so loose where it's allowing air to just completely get in, not going to be appropriate. But a lot of these cloth masks are not designed to be super, adherent to the face. They're just there to prevent, that direct exposure. So I think that unless you're wearing an N95, wearing it, at least covering both the nose and the mouth, should be sufficient.
So I'm wondering, I'm a runner and I go out a lot and I see people, and I'd say it's kind of 50-50. You know, some people, when they're on a run outside, will wear masks and some people won't. Personally, I don't. But what do you think? Is it necessary to wear a mask if you're by yourself on a run? What are your thoughts on that as far as safety?
That's a tough one to answer. I'm gonna, if you're by yourself, you're not around people, your exposure is obviously diminished. But if you're running, I think again, anytime you're wearing a mask, you're reducing your risk. So it should be beneficial to try and wear one. But if you're not going to be near people, your exposure is going to be pretty negligent. So I think it's a pretty appropriate thing to be able to not wear a mask when you're running, as long as you're not running directly across people where you're passing each other on those narrow paths. I think it should be okay. I do see people that are outdoors walking that aren't wearing masks, but at the same time, they're not near anybody. I'm catching them on the horizon, so to speak. So I think that it could be, I think it's okay to not wear a mask as long as you're not around people. But if you're in a situation, you're in an enclosed space, you're at a store, you're on a plane, you're doing things you're out and interacting, then a mask should be definitely necessary, specifically if you're going to be walking, downtown areas, things like that. But if you're just running in the park, I feel that you should be okay without the mask as long as, again, you're pretty much by yourself.
So Dr. Taweel, we've talked to you in the past, Dr. Jamie Taweel, internal medicine specialist at Grand River Medical Associates, about the testing that's been increased, and we've seen antiviral research and antibody research and vaccine research also going on. We talked to you a little bit about that in the past. Have you heard any updates from local labs or from research facilities that maybe you're in contact with about the progress on these tests?
I'm hearing I'm getting reports that the testing is getting much more improved. There had been a higher risk of false positives with certain tests, most importantly the nasal swabs, but I'm finding out that false negatives. But I'm finding out that the newer antibody tests are starting to come through that are being a little bit more accurate, that are getting really, really accurate results and giving patients at least a better idea. So it makes contact tracing a little bit better. So I think that things are starting to pick up a little bit, and we're starting to get faster turnaround times on these tests, and we're getting more reagents. So these tests that used to take, up to 3-4 days, now we're getting pretty much almost 24-hour testing. There's even newer ones that are coming out that are pretty much 15-minute tests with a blood drop. I don't know how efficacious those are. So I'm going to reserve comment on those, but I do know that the antibody testing is getting a lot more improved. So I'm quite pleased to hear that.
Dr. Jamie Taweel, internal medicine specialist at Grand River Medical Associates. Before we let you go, anything else you'd like to say? Anything else important that we haven't touched on that you'd like to speak on before we let you go?
No, thank you for having me, but I also just please stay safe. Continue to wear masks. They do help. They do work. We're trying to reduce this as best that we can. Any questions, always contact your doctor. If it's something that needs to be seen, they will let you know. So don't be afraid to get a hold of your doctor. You're not bothering them. That's what we get paid to do. And hopefully we can all stay safe out there. Any questions, I'm always glad to answer. So I appreciate you having me on. Thank you.
We appreciate having you with us, Dr. Jamie Taweel from Grand River Medical Associates, an internal medicine specialist, joining us on the MegaCast.